I'm Dr. Lane Smith, and this video is for anyone who is interested in breast augmentation surgery. I am a board-certified plastic surgeon and one of the most experienced breast augmentation surgeons in the entire United States. If you are interested in breast augmentation surgery, I think you will find this short tutorial video very helpful. If you are going to be a patient of Smith Plastic Surgery, I want you to watch this video very closely. Breasts can be augmented or enlarged by one of two methods. We can use the patient's own fat to enlarge the breast or by using breast implants. Fat transfer is useful in women who do not want to have breast implants. Typically, the fat is harvested from one of two areas, usually the abdomen or the waist, or sometimes both areas, the abdomen and the waist. Because fat transfer to the breast involves more surgery than routine breast augmentation using breast implants, fat transfer to the breast is more expensive than routine breast augmentation. For the purposes of this video, there are basically two types of breast implants. Breast implants can be filled with salt water that matches the body's bloodstream. These implants are called saline implants. They are filled with salt water or saline. Breast implants can also be filled with a silicone gel. These implants are called gel implants or silicone implants. The outer shell of both types of implants is exactly the same and made out of silicone. Silicone is used because it is relatively inert and rarely recognized by the body. Because the outer shells of both types of implants are essentially the same, the body recognizes them as essentially the same. In general, silicone implants tend to last longer than saline implants. They tend to look and feel more natural than saline implants, and they have less rippling or waviness. However, saline implants are less expensive and can be placed through a smaller incision. For most patients, I do recommend the silicone or gel-filled implants. One of the main questions that patients have is what breast implant size should I choose? Often, surgeons will simply pick the size for the patient, but different people like different things. At Smith Plastic Surgery, we will assist you in making your breast implant choice, but we allow the patient to pick the size that she prefers. Implants come in cc sizes. 1 cc is essentially 1 milliliter of fluid, or 30 cc's is the same as 1 ounce of fluid. However, for patients knowing this, it's still confusing. Basically, for every 150 to 175 cc's, that equals 1 breast cup size. So for example, if a patient is an A cup and she wants to be a C cup, we would place an implant that has at least 300 cc's. That would go up 2 sizes. However, this is still confusing for patients. At Smith Plastic Surgery, we will help you pick the breast implant size by sizing you. This means we will put you in a bra that is approximately the cup size you want to be, fill it with different sized implants, place a tight shirt over you, and then have you look in the mirror and see the different sizes. This is the easiest and probably the most accurate way to size you. At Smith Plastic Surgery, we also have the Vectra computer imaging system. This is a system where we can take a picture of you and then program it into the computer and enlarge your breast different cup sizes. Believe it or not, the computer is not as accurate as actually just seeing it on your body. So even though we have the ability to computer image you, and you are welcome to do that if you would like, usually patients find it easiest to choose the bra cup size by trying on different sizes, looking in the mirror, and picking the one they want. If you're in my office watching this video while waiting to see me in consultation, it is likely that my staff has already come in and sized you. I will review the size with you and help you making that final decision, but as always, the final decision is the patient's. The next choice a patient has is to decide which incision she wants to have her breast implant placed through. There are basically 3 incisions that can be used, and I will go over the advantages and disadvantages of each type of incision. Breast implants can be placed through an incision in the armpit. This is called the transaxillary incision or the transaxillary approach. The advantage of the incision being in the armpit is that there are no scars on the breast. However, there are several disadvantages to the transaxillary or armpit incision. The first is that this is the most painful way to place the breast implants. It's about twice as painful to place the implant through the armpit incision than it is through the other 2 incisions. The other disadvantage of the armpit incision is that it is a more public scar. What I mean by that is when the patient wears a bikini or a sundress or a tank top and then raises her arm, the scar can be seen by those that are around her. So it's a more public scar. The other scars for breast implant placement are only seen when the woman is actually topless. Therefore, I usually only recommend the transaxillary incision for women who are keloid formers or for women who work in the adult industry and are seen frequently topless. Otherwise, for most patients, I don't recommend the transaxillary incision because it really is more painful and the pubic scar can be a problem. Another way to place the breast implant is through an incision in the areola, which is the colored skin that is located around the nipple. This is called the periareolar approach. The main advantage of this approach is that the scar can hide very well in the areola, especially if the patient has dark areola or it has darker skin in general. The main disadvantage of the periareolar scar is that there is probably a slightly higher chance of changing the sensation of the nipple. However, this chance is still very small. Another disadvantage of the periareolar approach is that there is probably a slightly higher chance of capsular contracture. I will explain what capsular contracture is a little later in the video. If my patient is an African American or dark-skinned, I will often recommend this incision because it is usually the most invisible scar for that patient and often can be virtually invisible even in bright light. If the patient has light areola or is light-skinned, I usually do not recommend this for them. The most common way to place the breast implants is through a small incision located underneath the breast. This is called the inframammary incision or the inframammary approach. The advantages of this approach is that it is the quickest recovery, it has the least risk of complications, and the scar is well hidden under the breast when the patient is sitting upright or standing. However, the main disadvantage is when the patient lies flat on her back, there is a small scar underneath the breast, and this can be noticeable. Fortunately, most scars fade for about 1 or 2 years, and after a couple of years, this scar can be virtually invisible. This is the way that I recommend for my light-skinned patients or for patients who are not good candidates for the periareolar or the other approaches. It is the most common way that I place the breast implant. The next choice that a patient has to make is to decide on whether to place the breast implant on top of the muscle or under the muscle. Here is an anatomical drawing. Notice that the breast sits directly on top of the muscle. An implant can go just under the breast only, sitting on top of the muscle, or the breast implant can go under the breast and muscle like this. It looks and feels more natural under the breast and muscle. The more of the patient that covers the implant, the more it looks and feels like the patient. Another advantage of being under the muscle is that the muscle helps keep the implant in its pocket a little better. When the implants are underneath the muscle and the breast, the muscle helps hold them in place so that they roll out less, or there is less lateralization of the implant. Therefore, being under the muscle helps hold the implant in its pocket better, and this is yet another advantage of being under the muscle. I recommend placing the implants for most patients under the muscle, which is also called submuscular placement. However, submuscular placement does have some disadvantages. One of the disadvantages is if the patient flexes the muscle, the implants or the breast will move a little bit. This is usually not bothersome to the patient, but sometimes when a patient is doing push-ups or pull-ups, the implants will move a little bit. This will not displace the implant or damage the pocket or even damage the implant, but it can be a nuisance for some patients. Again, the vast majority of patients are not bothered by this. Another negative thing about submuscular placement is that initially the implant will be very tight under the muscle. The muscle attaches to the arm and it wants to flatten out. So this force will tend to push the implants upward and outward. The skin and muscle will eventually stretch and the implants will drop downward and inward. However, this takes about 3 to 5 months. In fact, we don't actually want the implants to be perfect right away, or they will typically drop too low. The reason the implants drop for only 3 to 5 months is because the body eventually recognizes the implants as being foreign or not human, and it walls it off with a little bit of scar tissue. In 97% of the patients, they can't feel or even know that the scar tissue is there. However, in 3% of the patients, the body overreacts and places too much scar tissue. This is called capsular contracture, and it is the second most frequent complication of breast augmentation. When the implants are placed on top of the muscle instead of under the muscle, the risk of the extra scar tissue forming, or capsular contracture, increases to about 20%. This is another reason why placing the implants under the muscle is much better than placing the implants on top of the muscle. There is less risk of capsular contracture when the implants are placed under the muscle. Here's a patient before breast augmentation surgery and approximately 1 week after surgery. You can see in the postoperative picture the breast implants are way too high and the breasts look funny. Here's the same patient 4 months later, and you can see that the breast implants have dropped down to a nice and natural position. Here's a side view of the same patient. You can see 1 week after surgery, the breast implants look too bulgy on the top and the nipple is pointing slightly downward. As the breast implants drop, the nipple comes up and the breast takes on a nice and natural teardrop-shaped appearance. Here is a picture of a patient that came to me for breast augmentation revision surgery. I did not do her original surgery. The patient reported to me that her breast implants were perfect 1 week after surgery. This was the problem. They should not have been perfect. They should have been high. But they were perfect 1 week after surgery, and then they kept dropping for 4 months, and now you can see they're too low. You can see that approximately 80% of the implant is under the nipples, and the tan line of her bikini goes right across the top of her nipples. This is the most common risk of breast augmentation. The risk is approximately 5% chance that the implants sometimes stay too high and sometimes they drop too low. If the implants drop too low, we can push them back up like I did for this patient. If they're too high, I can drop them down, but it takes another surgery. If you are my patient, we charge you $900 for this surgery. She was not my patient, so I charged her $6,000 to fix her breasts. As I mentioned earlier, if you need touch-up surgery, we typically charge $900. If I was a patient, I would wonder, why is Dr. Smith charging me another $900 to move my breast implants up or move them down when he put them in? The reason we charge $900 for the touch-up surgery is because, unfortunately, I have only about 70% control over where the implants end up. I wish that I had 100% control, but I only have about 70% control, which is the most important part. And I will do my part to put the implants where they belong. But about 30% of where the implants end up is determined by the patient, how they heal and things they do. For example, smoking increases the risk of scar tissue forming around the implant, and the implants tend to stay a little higher. After surgery, we're going to ask the patient to massage the implants to prevent risk number 2, which is the capsular contracture. Massaging makes the implants drop, and we don't want them to drop too quickly, so we will put the patient in a supportive bra. What we really do is guide the implants into position. What this means is we'll watch the patient and follow her as she goes along and give her instructions as to how to massage and how to wear the bra. For example, if the patient comes in 1 month after surgery and the implants look perfect, I'm going to say, hey, the implants look perfect too early. I need you to wear the supportive bra day and night and massage much less. If the patient comes in a month after surgery and the implants are too high, I'm going to do the opposite and say, hey, you need to massage more and maybe not even wear the bra. So we guide the implants into place. This is the artistic part of plastic surgery. The better and more compliant a patient is, the less likely she will need to have a touch-up surgery. I'm actually nice to only charge $900 for the touch-up surgery. Most surgeons will do the touch-up for, quote, free, but, and this is important, they will charge you the full price for the operating room and anesthesia. That is actually the most expensive part. When you pay for the anesthesiologist, the nurses, the techs, the gowns, the drapes, the IV, the bag, the tubing, the gases, the meds, the sutures, it costs typically about $3,000 to put you to sleep for an hour. So when I take the patient back and do a touch-up surgery for $900, I work for free and I actually cover some of your costs. Again, most surgeons will not do that. Best of all is simply to avoid this, and the best way to avoid having to do a touch-up is to listen and do exactly what I say. Another question patients may have is about implant profile. Implants come in different profiles. This means they have slightly different shapes. An implant can be more tall and skinny or shorter and wider. The tall and skinny implants are called high-profile implants. The widest implants are called moderate profile implants, and there are implants in between those two that is called moderate plus. Profiles deal mainly with the width of the implant, not actually the position of the implant. Patients get confused. They think the high profile implants means the breast will be high. They think that the moderate profile implants means that the breast will be low. This could not be farther from the truth. A high profile implant can be placed in a low position. A moderate profile implant can be placed in a high position. So actually the height of the breasts and the height of the implants have nothing to do with the profiles. Profiles mainly do with the width of the implant. It is important that the patient have the proper implant width. This means that we want the patient to have one finger cleavage in the center, and usually we do not want the implants to stick out too far in the armpit. This is a little bit complicated, but you should allow me to pick the profile of your implant. If you want to know more about it, I'll be happy to discuss this with you in consultation, but it is best to trust me to choose the proper profile for your implant. Now we come to the best part. Patients often wonder, how will the implants look? Often, surgeons will just do the same thing on everyone. For example, if a surgeon likes the high fake look, all of his or her patients will have a high fake look after surgery. If a surgeon likes a more natural look, all of his or her patients will get a more natural look after surgery. But at Smith Plastic Surgery, we like to give the patient different choices. Different people like different things. Basically, we give you 4 different choices. The implants can be in a high, more fake position. They can be medium high, they can be medium, and they can be low. And I'll explain these differences to you and show you some pictures. Here's a picture of a patient 6 months after surgery. These implants are not changing, they're set now. Remember, implants drop for about 3 to 5 months, so these have dropped and these have set and they're not changing. These implants are in the high position. It's kind of difficult to see why they're in the high position, so I'll explain it to you. If you look at this picture and draw a line through the nipples and a line under the breast and a line on top, you see that 60% of the implant is above the nipple and 40% is below the nipple. If you look at her from a side position, she's a little bit more bulgy and a little bit more fake looking. This is the high position, about 60% of the implant above the nipple and about 40% below the nipple. If the patient likes a fake look, we want to put the implants in the high position. If the patient likes a really fake look, we'll put the implants in a high position and put in a more fake looking implant. The next position I'll review is the medium position. Again, if you draw a line through the nipples and a line underneath the breast and a line on top, you see that it's about 50-50. About half of the implant is above the nipple and about half is below the nipple. This is a more natural look. And if you look at her from a side view, she has a nice teardrop shape. This next position is the low position. Once again, if you draw a line through the nipples and then a line underneath the breast and on top of the breast, you see that approximately 40% of the implant is above the nipple and 60% of the implant is below the nipple. If you look at a side view, you can see that this is actually the most natural position. The problem with the low position is I usually don't recommend it in young women or women who have not had children. The reason for this is because if you're a young woman or if you haven't had children, when you do have children and as you age, the implants will drop. I don't like to start the patient in a low position because it leaves no room to drop at all. Meaning as the patient ages, if they drop even a little bit, they'll look droopy. If the patient has a baby, they'll look droopy. So I prefer not to use the low position very often, and I usually don't like to use it in young patients. If the patient wants a more natural look, I usually recommend the medium position. If the patient wants a more fake look, I usually recommend the high position. Another position that I really like is the in-between medium and high, or the medium-high position. The advantages of the medium-high position is that it is a little bit high, but not so high that they look fake, but high enough so that they have some room to drop or even a little more room to drop than the medium position. So my favorite position for patients is either the medium position or the medium-high position. However, the patient has their choice and they can pick any of these 4 positions. Sometimes this can still be a little bit confusing or overwhelming. Rest assured, you do not have to pick your implant position or even the size today. We are willing to change the implant position and the size even until the last second prior to surgery. So it's important to kind of get an idea what size you might like and what position you might like, high and fake or medium and natural, but you don't have to pick today. I hope this tutorial has been helpful for you. I know that sometimes it can be a little bit overwhelming and a little bit confusing. However, the good news is we have covered the main points of breast augmentation, and if you understand these things or even reasonably understand them, you will be a well-informed patient. I created this video to help you and to make things easier for you. If you have any questions and you are waiting in my exam room, I will be in shortly and I will answer any questions you may have. If you are watching this tutorial online, feel free to email us at info@smithsurgery.com. Again, that's info at smithsurgery.com, and we'll be happy to answer any questions you may have. Or if you prefer, call us and we'll answer those questions directly over the phone. If you are waiting, I look forward to seeing you soon and helping you with your breast augmentation.